Morning glory, evening grace, brethren and sisters. Good to have all of you back along with us here with Temperance Awakening, and I look forward to doing our next tobacco lecture here. Today we're going to be covering a couple of topics. First we're going to be looking at medications and smoking, and then we're going to be looking at the mouth and tobacco. And so now starting with medications and tobacco, to ensure that medications do not interact dangerously with chemicals normally found in the human body, prescription drugs undergo years of safety testing before they're allowed on the market, and usually that's a very long time. That's around 5 years, 5+ years. That they're tested before they're allowed on the market. And of course, even after then, warnings like are on the packaging of of prescription and over-the-counter medications, warning people about mixing those drugs with other things. That could be tobacco, alcohol, or other kinds of medicines. And a cigarette smoke contains about 4,000 chemicals, and the act of smoking brings these chemicals into the body. And the most active substance is nicotine, as we've mentioned here. That's in all tobacco, not just cigarettes. And a nicotine which initiates numerous activities both in the brain and the body. And that activity can change when nicotine is combined with prescription medicines. And interactions might cause the medicine to be less effective, or they can increase the action of a drug. And another result could be an unexpected side effect. And so now looking at nicotine in medicine. As nicotine enters the body, it causes a series of direct reactions in various organs. These reactions counteract the effects of certain drugs. Theophylline, for example, is a medicine that opens the passages that channel air into the lungs, and nicotine causes these air passages to constrict or tighten up, countering the effect of the drug. Since theophylline is part of many medications for asthma, patients can have trouble breathing, and of course anybody taking any type of asthma, medication should examine the instructions about it, and especially look at what smoking could do with taking it, because people with with asthma or any breathing difficulty are usually urged to give up smoking and avoid tobacco smoke. And another direct effect of nicotine is a constriction or narrowing of blood vessels in the body, which causes a sharp rise in blood pressure. And people who are diagnosed with high blood pressure, which is more professionally known as hypertension, is already on medication for that, his or her smoking habits, or really any tobacco use, because even like chewing tobacco and dip snuff, can raise blood pressure. And they need to be aware of all those things and discuss with a physician if you're taking medicine for hypertension and use tobacco. And nicotine also makes the heart beat faster. Certain medicines prescribed for heart disease may have more difficulty controlling cardiac problem if the patient uses any type of tobacco, because once again I know that even like chewing tobacco and dip makes the heart beat faster. And when prescribing medication, a physician expects a certain dosage of the substance to remain in the body for a specific amount of time, and that's why some pills are taken once a day, while others, might be taken 2 or 3 times a day. And then enzymes released from the liver help to break down medications in the bloodstream. Enzymes are body chemicals that trigger chemical reactions, such as the breakdown of food into substances the body can use in waste that will be excreted. And drug companies calculate their dosages based on the rate of breakdown and excretion for a medicine by the amount of enzymes normally found in the body. And the difficulty with nicotine is that nicotine stimulates the liver to produce additional amounts of certain enzymes, and these extra enzymes can eliminate medicine in the blood too quickly, reducing the effectiveness of the prescription. And like tobacco has been shown to reduce the effectiveness of a wide range of medicines. Like one of these being anticoagulant drugs that thin the blood, like heparin, and pain medications such as Talvin and Darvin. And some types of anti-anxiety drugs can also be affected, like Librium and Valium. And nicotine also reduces the antipsychotic drugs such as chlorpromazine, clozapine, and olanzapine. And certain antidepressant drugs have a reduced effect as well, because stimulants such as nicotine affect the heart rate. And smoking also affects insulin production by the pancreas, which is an important consideration for people with diabetes. And nicotine is actually even also mentioned in relation to Viagra and things such as that, like things that help a male with that help males with erectile dysfunctions, because nicotine has been linked to erectile dysfunction. And physicians aren't exactly aware why this is, but it could be because of poor blood circulation, because as we said, nicotine causes blood circulation problems, and it could also even be a cardiovascular thing, because like as we said as well, nicotine, makes the heart beat faster. And this problem can only be reversed by stopping tobacco. And now looking at a big problem here, what's that? And perhaps the most dangerous thing that you can mix nicotine with is more nicotine. And people attempting to quit tobacco, they can could possibly use, over-the-counter nicotine replacement therapies or prescription nicotine replacement therapies. Like some of these being the patch, the gum, lozenges, which is hard candy, which is like something similar like to cough drops, the lozenges that help people quit tobacco, or like inhaled nicotine spray. And instructions for the use of these products make it clear that users cannot use any kind of tobacco, while using these treatments. And each nicotine replacement therapy method depends on delivering a measured dose of nicotine to blunt the cravings as the user tries to quit. And, just using, tobacco, like if you smoke, dip, or chew tobacco, that's just going to put more nicotine into your system, and perhaps more nicotine than the blood can handle, because nicotine is, after all, what? Nicotine, is a poison, and that's why it causes so many diseases and illnesses and things, so much harm to people's bodies. And if nicotine levels in the body are too high, toxic reactions can occur. These symptoms could be cold sweat, dizziness, feeling sick to the stomach, a rapid heartbeat, weakness, drooling, confusion, and even fainting. And now also looking at some recent research talking about something called nornicotine. In 2002, scientists at the Scripps Research Institute in California studied the way nicotine breaks down in the human body. They discovered that one of the products of that breakdown, a compound called nornicotine, does considerably more than anybody had previously thought. Nornicotine appears naturally in tobacco and tobacco smoke. Unlike nicotine, which breaks down quickly, nornicotine remains in the bloodstream. And nicotine in the body acts like a neurotransmitter, a chemical which helps to deliver messages along nerves, creating certain responses in the brain and in other organs. Nornicotine acts as a catalyst, a substance that causes chemical reactions to occur. Previously, scientists believed that only enzymes perform this function in the human body. Now they have found that nornicotine interacts in important bodily reactions like turning the sugar glucose into energy or affecting medications. And tests have determined that nornicotine reacts with prescription steroids like cortisone and prednisone, possibly making them more toxic. And there could be also other reactions like with other antibiotics, which is why studies and research continues about nornicotine, as that could just be another issue that goes along with tobacco. And now we're going to talk about the mouth and smoking. The mouth and smoking, or the mouth and tobacco, really all of tobacco here. Now we're going to look at. And the mouth is the gateway to the body, providing access to the stomach and the lungs and permitting human speech. Like all food and lots of things, go through our mouth before they enter our lungs and our stomachs. And besides letting words out, the mouth permits, as we said, entry of food and air. Because, whenever people do breathe through their mouth rather than the nose. And of course, the mouth also allows entry to germs, pollen, and pollutants. So it must also serve as one of the first lines of defense for the body. And many people consider saliva to just be mouth juice, something to keep lips and tongues moist. But saliva is actually a mixture of mucus and enzymes. And these are substances which trigger chemical changes, such as breaking down protein, which helps to destroy bacteria in the mouth. Saliva traps bacteria and rinses and cleans the mouth. And no matter how, like people use tobacco, whether they smoke, chew, or dip, the mouth is always affected. And of course, in some ways, like chewing tobacco and dipping, that can even be worse for your mouth, than smoking, because of the way, that tobacco is held in a person's mouth when they chew or dip. But a continuous exposure to any kind of tobacco, that's dip, chew, or cigarette smoke, it makes the mouth the secondary deposit site for nicotine. And then if you also do smoke, like tar, then other numerous chemicals that are in cigarettes or cigars, they enter the body with every puff. Now, whenever people discuss tobacco, we usually talk about those long-term problems. They get the most attention, like lung cancer, heart disease, and stroke. But some consequences of tobacco come earlier, and the mouth must deal with damage on a daily basis, and that damage results in some of the most notable changes in the body. It can also lead to disfigurement. And now, like talking about gum disease. And people rarely pay much attention to their teeth unless they hurt. However, teeth are pretty amazing. With the help of powerful muscles in the jaw, teeth can exert pressure as high as 7,000 pounds per square inch. And, the Lord, made our mouths that way to be so strong, so we can handle the job of, cutting, tearing, and chewing food. And teeth also help in the production of sounds for speech as well. They also help define the shape of the face. Only about 1/3 of the tooth, which is the crown, is visible. Like what we see in our teeth when we look at them, is actually the crown of the tooth, and it's only 1/3 of the tooth. The rest of the teeth are anchored solidly in the flesh and the gums. And just as chemicals in cigarette smoke cause problems for tissues in the lungs, smoke causes damage to the gums in the mouth, as does like smokeless tobacco. And people that use tobacco are much more likely to have problems with something called calculus, not the kind of math, but the hardened dental plaque that forms on the lower sections of teeth under the gums. And a plaque is a sticky combination of mucus, bacteria, and tiny food particles. And as the plaque hardens, bacteria in the calculus attack the tissues of the gums, creating pockets that fill with more bacteria, which in turn attack more gum tissue. And the skin of the gums begins to pull away from the teeth. If the condition continues, it can lead to a loss of bone, connective tissue, and teeth. Like in the early 1900s, most people over the age of 60 didn't have teeth, because that was before we had all the technology, that we have now, that helps dentists and things, keep people's teeth, even when you're an older person, a senior citizen. And they lost teeth like in the early 1900s because of decay or gum disease. But now, with our modern technology that helps dentistry, like people over 60 are much more likely to have all their teeth, or, at least most of their teeth. But the affections of this are, people who use tobacco, because their gums are often swollen and receding from the teeth. And the American Academy of Periodontology, the branch of dentistry concerned with gum health, warns that using tobacco accelerates the progress of gum disease. And people who use tobacco, that their teeth often needs more, dental work, to remove calculus. The dentist must physically scrape the teeth, including the area below the gum line, because particularly smokers particularly often use breath mints and sugar. Breath mints, because of what smoking does to your breath. But breath mints, though, are full of sugar, and that also causes tooth decay. That just adds to the issues of smoking. And dental visits, are usually more painful, for people that use tobacco, and treatments are often less effective. And one of the effects of smoking is a reduction of oxygen in the blood. And with less oxygen and fewer nutrients, gum tissues heal more slowly and are more prone to infection. And that's really not just true for smokers, but anybody who uses tobacco, because even chewing and dipping, that can also reduce the oxygen in the blood, because of the nicotine that's in your system. And according to a 2000 study by the Centers for Disease Control and Prevention, people who use tobacco are 4 times more likely than non-tobacco users to suffer from gum disease. And like particularly with smokers, people who smoke more than a pack and a half per day are 6 times more likely to face infection. And of course, like all, as we said, all tobacco irritates gum tissues. And like particularly, like with smokeless tobacco, like people who dip, they put a pinch, of tobacco between their lips and gums. And, and the effect is often concentrated in that section of the mouth. Like I've actually seen that before, like people like who dip, like you can look, have actually showed me, like the inside of like their mouth, you see how like red, their gums are, and they often have skin, and stuff peeling from their gums because, their gums start receding deeply. And smokeless tobacco also causes open sores in the mouth and gums, and can cause something called leukoplakia, which is a precancerous growth in the mouth. And recent dental research not only links tobacco use to gum disease, but also suggests that the combination of tobacco use and gum disease can lead to other ailments, like a 2001 study reported in the Journal of Periodontology suggests that chemicals in tobacco may create a favorable environment for bacteria that can cause gum disease. Ongoing research at the University of Manitoba Dental School focuses on several issues related to tobacco and gum disease, including, maybe whether tobacco use causes the release of enzymes that inflame and harm gum tissues. And researchers think that gum disease bacteria releases toxins that travel through the bloodstream. These toxins could be responsible for the inflammation in blood vessels that is connected with cardiovascular disease. And some of these chemical agents may also contribute to creating blood clots that cause heart attacks and strokes. And in 2002, the Journal of the American Dentistry Association examined 9 studies that linked gum disease with heart disease. And although the reviewers found that the evidence wasn't strong enough to make a definite connection, research continues. And now this is kind of looking at one of the immediate problems, the sooner problems that can come from tobacco use, staining and a loss of teeth. And that's what happens with people that use tobacco, any kind of tobacco. They usually have very stained teeth and they lose teeth. Well, like in 1624, the Dutch painter Rembrandt van Rijn painted a group of soldiers. And since the 1800s, the group portrait has been called the Night Watch because the soldiers seem to be marching in darkness. When the painting was cleaned in 1946, the restorers discovered that the soldiers were not on a night march after all. Over the century, soot and smoke had darkened the varnish, protecting the painting, turning it brown and turning day into night. That's what tobacco smoke does. And like inside your mouth, smoking does a similar job and much more quickly, or really any kind of tobacco, but especially though with cigarette smoke and tar. When tar, the solid particles found in tobacco smoke that collect in the lungs, mixes with saliva in the mouth that coats the teeth. The effect is much like brushing a liquid stain onto wood every time a smoker lights up, a new coat is applied. Brushing and flossing help to minimize staining, but few people brush after every cigarette. Of course, that's also those who, especially for smokeless tobacco, like people like who use this, who use that, that tobacco, what we call tobacco juice, like in their mouth, stains their teeth the same way. And after a few years of using tobacco, it stains the outside of the teeth. A dentist can clean off the discoloration, but with time, however, stains become established in microscopic cracks in the tooth enamel, the outer covering of the mouth, and the discoloration becomes harder to remove and can become permanent. And teeth take on a brownish color, and flat surfaces where the tar is able to accumulate can even become black. Teeth can also show increased wear on their biting surfaces. And although staining is unattractive, it really doesn't cause any serious problems to the teeth. But as we've been talking about gum disease, though, however, can cause serious harm. And as the gums recede, they expose the roots of the teeth. The bacteria in the gum pockets don't just attack the tissue of the gums, they weaken the bone and the connective tissue that holds the teeth in place. And the results of this are painful teeth. And according to a study by Tufts University in Boston, like people who smoke a pack per day can expect to lose 2.9 teeth after 10 years of smoking. So that's almost 3 teeth that are going to be gone after 10 years of smoking. And during the same 10 years, non-smokers will lose just 1.3 teeth. And at that rate, a person who started smoking at age 18 and smoked a pack per day would lose 4 to 5 teeth by age 35. And the Tufts researchers also found that smokers who quit lost fewer teeth. However, ex-smokers, though, still did lose more teeth than non-smokers. And replacing lost teeth or trying to stabilize loose teeth is very expensive. Unreplaced teeth certainly have an effect on somebody's appearance, as you consider how somebody's smile is going to look with gaps in it. Lost teeth may also change the shape of the face. And then another issue, particularly with smoking, is bad breath. Of course, that's actually also true with smokeless tobacco users. But especially people who smoke, though. Like you visit a smoker's house and, you'll notice a sharp, hard-to-miss smell. Because the distinctive odor of cigarette smoke sinks into furniture, like clothing and even hair and skin. And if you've ever been face-to-face with a smoker, or like anybody that uses tobacco, you also know that smoking also affects their breath. And not to mention, like we kind of mentioned that with the painting at the beginning of this, like with the staining. Like I remember going into particularly somebody's house before who smoked. I could see both of them smoked, the man and the woman of that house, and like the walls in their house, like were even stained, like were yellow because of all that cigarette smoke. And unless somebody brushes after every time they smoke a cigarette or have a dip or a chew, which is highly unlikely because most people aren't going to brush their teeth, every time they have a cigarette or a dip or a chew, the residue of that tobacco remains on the breath, including the tar particles that stain the teeth. But that's just the tip of the iceberg. Saliva washes away and neutralizes bacteria in the mouth. Smoking dries oral tissues, leaving a smoker with a mouthful of germs and their waste products, and that result isn't a pretty smell. Then you add to the fact that gum disease has its own distinctive aroma, and you have 3 sources for offensive odors. Smoking, I know, can look cool in all the young people, but up close and personal, not. It looks very off. And just lastly here, we see we have a very visible problem. Much of the damage that smoking does to a person, cancer, for example, or heart and lung disease, takes place deep within the body over many years. What smoking, or really any tobacco use, does to the mouth, however, happens much more quickly, and the results are much more public. Stained teeth, bad breath, or a gap-toothed smile are very hard to ignore, and these conditions definitely affect the impression that a person makes. And that's why, like we particularly say this, like to young people, if you use tobacco products, that looks very bad for your appearance, especially as a Christian. We're to abstain from all appearance of evil. And like with a man of God is to be blameless. I certainly do not think that a preacher who uses tobacco is even qualified to be is qualified to preach, because a man of God is to be blameless. But even for somebody that isn't, like I said, we say particularly young people, like whenever you get older, using tobacco products, also doesn't look professional. And that can really affect your personal life, like getting a job and things. So thank you so much for being there with us. And I'll look and see here what we're going to be looking at. The next lecture, we're going to be looking at a couple of things. Peer pressure and smoking, and also quitting therapies. The quitting therapies for smoking. And so we look forward to that. Come on and be back with us next class. And until then, until the day breaks and the shadows flee away, I am Brother Cooper, and we'll see you next time, and we love you, and we appreciate you.